Hey, good. Thanks.
Now, over the last 20 years, the amount of children admitted to hospital due to allergic reactions to food has increased by a massive 339%.
It's kind of crazy to get your head around that, isn't it?
Yeah,
So in a bid to tackle this, the UK's biggest allergy organisations have developed new guidelines to help keep children safe.
And Professor Adam Fox has been involved in the campaign. He joins us now from his home to explain more. Good morning, Professor Adam. How are you doing?
Good morning.
So,
the question is why?
Exactly.
Why is this actually happening?
What's interesting is that the anaphylaxis in children has increased by 339%. And when I read my notes, what I couldn't believe is it's only 20 years. It's 1998 and 2018. So why do you think this is?
Well, if you look back 40 or 50 years, it was really unusual to meet somebody with a food allergy. Now it's something that's really common. It affects about 5% of UK kids. We don't really know why there's been a massive increase, but if you look at the data that we've got at the moment, it suggests that there's lots more people coming to A&E with severe reactions, but it doesn't necessarily mean that there's more people with allergies. There's certainly more people with food allergies than, say, 40 or 50 years ago, but we don't think that that's currently increasing at anything like that rate at the moment. But people are just more likely to show up in A&E having had a bad reaction now.
And what are the new allergy guidelines that you're now going to be introducing into schools? Tell us about those.
Yeah, I think this is really good news. So for a long time, there's been a real issue with schools being able to look after kids with food allergy. And if you bear in mind how common it is to have a food allergy, pretty much every classroom is going to have at least one child with an allergy to milk or egg or nuts or something like that. And parents need to know that when their kids go to school, that they're going to be safe there and that the school knows how to recognise reactions, how to treat them if they happen, and ideally how to prevent them from happening in the first place. 20% of severe reactions happen in school. And unfortunately, in the last few years, we've had a couple of cases of fatal reactions that have happened at school. And the inquests have found that things haven't gone as well as they should have done. The kids' EpiPens, for example, weren't in date. The reactions weren't recognised as being as severe as they were as quickly as they should have done. And that's meant that treatment wasn't started as quickly as it should have been. So there's a bit of inconsistency going on in schools. So what the Anaphylaxis Campaign and the Allergy UK, the two big allergy charities, have done is got together and come up with a model policy for managing allergies in schools. So the idea is that rather than leaving schools to just come up with their own policies, which is what's happened in the past, there's statutory guidance for schools that they have to have a policy, but not really guidance on what that policy looks like, what it includes. But now there's really clear guidance for how schools can make sure that they're doing the best for kids when they go to school with their allergies.
That's wonderful.
Yeah, thanks, Dr. Adam. Listen, we've had loads of calls on this, so let's go straight to them. Sian in Kent. How you doing, Sian? Good. Thanks for joining us.
Morning, good. You okay?
Yeah, really good, thanks, Sian. What's your question about allergies?
Good. So my question is, I seem to have an allergy to things like bread and various other products that include wheat, like biscuits, and a lot of vegetarian and vegan alternatives have wheat in, but I don't flare up to things like dried pasta. So when I do get a flare-up, it causes stomach irritation and really heavy, painful cramping. I'm wondering what it could be and what the best way is to pinpoint it.
Okay, so those sorts of symptoms with tummy aches and sometimes loose stools, things like that, they're not classic symptoms of an allergy. So an allergy is when your immune system's involved and it's potentially dangerous, and typically symptoms would be you eat the food and very quickly you get swelling and hives and itchiness. Whereas what you're describing sounds more typical of an intolerance, and there's a whole range of foods that can do that. But frustratingly, there aren't any really good, reliable tests for intolerance. Unfortunately, you have to do it the old-fashioned way, which is essentially thinking about what it might be, cutting that food out, seeing if it all gets better, and then reintroducing it to see if it gets worse again. What I'll definitely advise that you don't do is go online and get one of these online testing kits for intolerances. They don't have any scientific validity behind them, so they're likely to just come up with a load of things that aren't really going to make any difference at all. What would be ideal, because often GPs aren't necessarily able to sort of engage with the detail that needs to happen to work this out, would be to ask for a referral to a registered dietitian. Dietitians are real experts at this. They have a really good understanding of food intolerances, and they can help guide you at taking the right things out of the diet to see if it helps, putting the right things back to make sure that it really was that and you don't end up avoiding something unnecessarily, and making sure that along the way you keep all the important things in your diet so you don't go short of iron or calcium or the other things that you need.
I hope that helps, Sian.
Yeah, that's fine. That's great. Thank you. I'll do that.
Oh,
Thanks,
thank you
Sean.
for calling. OK, let's go on to our next caller, Joe. Where are you calling from, Joe? Morning.
Hi, morning. I'm calling from South Wales.
Oh, lovely. Well, you want to ask a question about your 2-year-old son. Tell us about that.
Yeah, so basically, about 5 weeks ago, he had norovirus, and then he only had sickness. And then 2 weeks later, he developed very loose stools, lasting about a week. So I went to see my GP, and they advised it could be a dairy and lactose intolerance following the norovirus. So they've advised me to cut out lactose for 8 weeks and dairy for 2 weeks. And it's still gone loose again. So I'm wondering how long I should keep in dairy and lactose to go about reintroducing it.
Sure. So that's a really good story for a lactose intolerance. What happens is normally we have something called lactase. That's the enzyme in our gut that breaks down the sugar in milk, which is called lactose, and it lines the inside of our gut and does its job normally. But if you get a nasty tummy infection, and a norovirus would certainly do the job, then as the inside lining of the gut gets all inflamed, it sort of erodes away all of that enzyme, so it's not there for a little while. And it takes the gut about 4 to 6 weeks for it to come back again. So I think you've been given good advice that you should cut down the lactose in his diet, but you're going to have to do a little bit of trial and error because everybody takes slightly different length of time for it to get back to normal. So start with a little bit of lactose containing food, so soft cheese or a little bit of milk, and see what happens. If the stools go loose again, then you just need to wait a little bit longer. But what you'll find that gradually the tolerance of those things will get better and better, and it will always come back to normal. It's just a matter of being patient. So don't worry about it. It will get better.
Oh, good luck with that,
Good luck, Joe. It sounds rotten. Yeah.
Thank you. Thanks very much.
Oh.
OK, let's go to Yvonne now. Hello, Yvonne. How you doing?
Good morning. I'm good. How are you?
Morning.
Yeah, good. Thanks, Yvonne. OK, you've got a question about wasp stings.
Yes, my 11-year-old daughter in the past year has been stung twice by a wasp. First time it ended up in A&E with cellulitis and had to have antibiotics for a few months. The second time we were on holiday in Mallorca and she was bitten, not sure if it was a wasp or not, but she was bitten in the foot. And the following day, her whole foot went like a black part of the whole foot to her ankle, went black and purple and double its size, and ended up back in the doctor's there and got antibiotics and it cleared up. So now we're just concerned, especially now up here in Scotland, although our windows have to be open at school, a lot of wasps are dying off. So we're just concerned, is this something that's going to get worse every time she gets a sting? Is it an allergy or has she just been unlucky?
I think it's unlucky. It doesn't sound like allergy. People really worry about severe reactions to bee stings and wasp stings, but thankfully those are really, really rare. One thing to remember, which reassures a lot of people, is that you can't have an allergic reaction to something your immune system has never seen before. So if you've never been stung, you can't have an allergic reaction to your first ever sting. But if you've had lots and lots of stings, and so the people most commonly who get insect sting allergies are actually beekeepers because they get loads and loads of stings. But for most people, it's really unusual. But what you'd expect if it was an allergic reaction is after you've been stung, very quickly, within a few minutes, you'd start getting a rash and swelling and hives that would be places other than just where you've been stung, as opposed to what commonly happens with stings. And what you're describing is where you get stung, because of the toxin that's in the venom, you'll get swelling and it can be red and sore, and sometimes it takes a few hours to develop. That's just the sting itself. And if you're unlucky, like it sounds you have been, and infection gets in there, then things will get worse and it needs antibiotics to calm it down. If you do think you've had an allergic reaction to a sting, it's definitely worth getting seen. So if you've had those symptoms of the itchiness and the swelling happening quickly afterwards, because if it's been a bad reaction and that's a medical emergency, call for help if that happens. We can treat that. There's something called venom desensitization, so a course of injections to make you less sensitive. But very, very few people need that. And most people, when they get stung, it's just a local reaction to the venom itself. If you do think it's an allergic reaction, keep an eye out on what it is that stung you. If it's left a little stinger inside, then it's probably a bee. And if it hasn't, if there's nothing to see at the site you've been stung, it's more likely to be a wasp, because actually they look very similar to each other.
Yvonne, I hope that helps.
Yeah, that's it. Thanks very much. Thank you.
Good luck.
Thanks, Yvonne.
And thanks to everyone who phoned in today. And thank you, Professor Adam. You've been amazing. Thank you.
Thanks,
Very
Adam.
much.
Very calming, isn't he?
Very calming indeed. Very calming. Thank you for calling in as well. Still to come, if there's something strange in your neighbourhood.